Oh, we should talk about prolapse. Prolapse happens after menopause too, more frequently. I'm like, there's something else that happens. Prolapse is the descent of pelvic organs through the vagina. And as the vagina gets weak or muscles get weak or the estrogen goes away and so the skin gets weak, women will experience more of a descent or a bulge in their vagina. Not life-threatening, not dangerous. And a lot of the times I just provide a reassurance to women to say, hey, let's do an exam. I do exams 10 times a day. I'll tell you kind of where I think this stands on severity. And a lot of it's just education to say, hey, this is where your body is. You don't have to do anything invasive about it if it doesn't bother you. So a lot of what I do is just kind of providing education and just a check and to say, hey, if things change, now I know we have this relationship, come back. And then maybe we would need to do something more invasive. But a lot of women are just reassured because somebody told them that they have a prolapse or they have a cystocele or and they don't know much about it. So we come in, we do an exam, and I just kind of say, this is what I'm seeing. These are the preventative things you can do as far as not making it worse, which sometimes is estrogen cream, physical therapy to strengthen the core. So when you lift or exercise, you're engaging that core so you're not kind of pushing out through your pelvis. Weight loss, anything that can take weight off of the pelvis. So we just kind of do some preventative education.
Okay.
Yeah.
Is there anything else you want to add?
Oh, I think my big thing is there's just one little me, how do I help women know that what they're experiencing, they're not alone, right? And it's like, because I see this every single day. That's the lady I was talking about who fixed her incontinence with physical therapy, and then she came back and she was super happy. And she's like, I feel like I just need to shout this from the rooftops, like, you can get better, right? And I think especially that statistic of waiting 8 years, is like to take it out of this like shame. They're just gonna tell me that this is normal and there's nothing I can do, to like go from that to go like, no, there are people like that. This is what they do with their life, and there are options, and now I have the education and knowledge that I know, that's why I guess that's my question is like, how do I educate everybody to be like, it's okay to talk about our pelvis, right? It's a body part that needs healthcare sometimes. Mm-hmm. Instead of this like, growing up in maybe a culture that tells us to be quiet and tells us that things might be shameful, or tells us to just deal, and to kind of be able to counteract that culture sometimes to be like, no, you're valid, and this is as important of a health condition as any other thing you'd go to a doctor for. So that's all. I'm like, I got a lot of work to do.
Well, this is a good step.
Yeah. I don't know, thoughts? Like, what did you think? I'm always curious to be like, because, when you guys come and stuff, it's like, what did you think it was like? And then, how does your perception change, like, once you know, because it's like, that's super important to be like, there's tons of people that have, to me, I'm very comfortable with doctors, right? But there's plenty of people who are like, that, I don't know, right?
Yeah, well, my first thought was this is going to be a really difficult article because, for one thing, I don't know anything about it, and then also to make it positive is always a little bit of a challenge, which is good.
I think, the baby boomers, I'm not a writer, but where I would go is like, baby boomers are, there's so many people, right? There's so many people, and we're living longer. Baby boomers especially are kind of the first generation to be proactive in this department. Like, their parents really were we didn't have medical treatments, right, for these problems, so that their parents just kind of told them to just live with it and deal with it, and it's normal. So baby boomers are the first generation to be like, I don't want to live the next 30 years like this, and they've been asking the questions and seeking the treatments, and like, they've really driven this, and I guess in kind of saying like, it's so incredibly common. Women are 50%, let alone, men have been seeking sexual dysfunction for 20 years. We don't tell them that they shouldn't, right? And now it's women's turn, and like, to me, that's just like equality and empowering. Mm-hmm. But yeah, it's like, there are so many people. There's like 10,000 new people turning 65 a day in this country, or something crazy like that. But like, as much as it's like niche-y, like, oh my god, I'm gonna talk about like incontinence and is like, oh my gosh, this is 50% of every single pelvis out on the street, you know, they've had babies, or they've had a urinary tract infection, or they're in a sexual relationship that doesn't feel right to them. You know, it's like, it's everybody, but nobody talks about it. And over, you know, I have women in and they're like, nobody. But once they start, and then they'll tell their friends, and they're like, I told 4 of my friends, and they said, I all had that problem too. So like, that's what I would think about this article, is like, as much as it's like this niche, it's everywhere, but nobody talks about it.
Mm-hmm.
That makes sense?
Yeah, definitely.
Yeah.
It is. And you're right. So it's like, it feels like a niche, but it's really not, because of the amount of people that it affects.
Yeah. It's so common. And then once women start talking to their friends about it, like, the stories just come out of the woodwork, you know, like, oh yeah, well, my mom, and oh, my sister, and oh yeah, me. And I think a woman who's been empowered is the most powerful, because